recent survey reveals that nearly half of beneficiaries do not know the difference between Medicare and Medicare Advantage. Welcome back to Preferred Medicare. I'm Holly Cohen, your licensed independent broker. Today, we are tackling an important topic that affects many Medicare beneficiaries. A recent survey reveals that nearly half of beneficiaries do not know the difference between Medicare and Medicare Advantage. So what I mean by that is original Medicare from the federal government versus Medicare Advantage. So let me give you some basics to help you better understand your options. First, let's break down the key differences between Medicare supplement plans, also called Medigap, and Medicare Advantage plans. Understanding these key differences is crucial for making informed choices about your Medicare coverage. Medigap plans, also called Medicare supplement plans, are designed to fill in the gaps left over by original Medicare. This means they pay for the 20% coinsurance. Most of the Medigap plans, such as a Plan G, leaves you with one small deductible for the year, which is $240. It keeps you on original, traditional federal Medicare, which allows you to go to any doctor, any hospital in the whole United States that will accept your red, white, and blue card. And then along with that, you would bring a second card called your Medicare Supplement card or Medigap card. And those are identified by a letter. It would be either a letter F on your card if you were born prior to 1955, or it could be a letter G, or it could be a letter N. Medigap plans help pay for some of the out-of-pocket costs that Medicare doesn't cover, such as the co-insurance and the deductibles of Medicare. With a Medicare supplement plan, such as a Plan G, you'll still use your original Medicare card for your medical services, but the Medigap plan helps cover the additional costs. You're only responsible for the Part B deductible, which for this year, 2024, is at $240. They have not yet released the new deductible for 2025 yet, which should be coming out soon. A Medigap plan, most importantly, standardized plans, and they allow you to see any doctor, any specialist, and any hospital that takes your Medicare card, your red, white, and blue card, without any referrals or without any prior authorizations. You're allowed to have treatments as long as your doctors have deemed it medically necessary. Now, on the other hand, Medicare Advantage plans, also known as Medicare Part C, is an alternative way to receive your Medicare benefits. These plans are offered by private insurance companies that are usually publicly traded on Wall Street, but approved by Medicare. And they include everything covered by original Medicare, meaning if Medicare has to cover a preventative colonoscopy, so will a Medicare Advantage plan. However, when you're on a Medicare Advantage plan, it is a private insurance company that is publicly traded, is looking out for their stockholders. So just so we're clear here, when you're on Medicare Advantage, you're no longer on the original Medicare, federal Medicare. You're on an insurance plan that has replaced your original Part A and Part B of Medicare, although you do still pay your Part B premium, which this year is $174.70 to Medicare. When you're on Medicare Advantage, it takes you off of original Medicare and it puts you on a privatized plan. Another key difference is that Medicare Advantage plans are allowed, because they've taken over your Medicare completely. You're no longer on the federal Medicare. They can decide which treatments that they will authorize or not. Advantage plans, these plans are offered by insurance companies. They are indeed a replacement for original Medicare, which means that the insurance companies can make up their own rules with these plans. They can put copays on at your doctor. They can put copays on at your specialist. To compare original Medicare with a Medigap plan, G versus a Medicare Advantage plan. On a Medicare Advantage plan, you have networks you have to stay in. So you have to make sure that your doctor or hospital stays inside that PPO or HMO network. If it's a PPO, yes, you are allowed to go outside of the network, but you're going to have a higher max out of pocket if you leave the network on a PPO Medicare Advantage plan. If you're on an HMO plan, you can't leave the network at all. Again, Medicare Advantage plans replace original Medicare. So on the alternate, when you're on original Medicare with a plan G, you can see any doctor, any hospital in the entire United States that takes your red, white, and blue card. There's no delays in treatment. There's no prior authorizations. You don't need referrals for treatment. You're only out of pocket for the year on a plan G is $240. Yes, there are catches. If you started off on a Medicare Advantage plan and at least 1 year has passed, then you would have to go through underwriting, medical underwriting, to get approved by a Medigap insurance company. And you're only allowed, if you're on a Medicare Advantage plan, to come off of that and head back onto original Medicare in the time frame of annual enrollment period, which is October 15th through December 7th. So mark your calendars. Again, October 15th through December 7th. That will give you the time that you will be able to unhook yourself, if you feel that way, from a Medicare Advantage plan, go back to original Medicare starting for January of 2025. And if you are lucky and in good health, you are allowed to switch. And also, Plan G costs money, so that's another factor that we have to factor into some of these things. Medicare Advantage plans are not the worst plans. They're just not nearly as good as original Medicare with a Medigap plan. So if that makes you feel any better, I am not yet on Medicare. I have an under 65 health insurance plan that I have to buy through the health insurance marketplace, an Affordable Care Act plan, and a Medicare Advantage plan is always better than any of those plans that are offered to the under 65 folks, unless I was working for a big company and I had health insurance through my employer. But no, we are a family-owned business. We have to have our own health insurance. And so we're stuck until we're ready to go on to Medicare. And then we will have either the choice of a Medicare Advantage plan or original Medicare with a Medigap plan. If you have any questions, open enrollment's about to begin October 15th. I know it sounds a little far. We're 2 months away, but it's really not. It's going to come up and grab us before we even know it. And we have a big election year. We have Thanksgiving thrown in there. It's going to be a whirlwind. So again, please stay tuned to my next video where I'm going to be announcing many of the changes for 2025 to look for and some key points that you're going to want to view, write down, make sure you are looking for when you're shopping around for 2025 if you have to do that for next year. All right, for now, as always, please be well.